part of the advantage of breast-conserving surgery in this era is that we approach it in a way to thoroughly and completely remove the disease, but yet allow the patient the advantage of a good cosmetic result and a breast that looks still appealing to the patient. When breast-conserving surgery was just being explored in the earliest days, the way that the surgery was done was not the way we now commonly do lumpectomies. Dr. Veronese in Milan pioneered the concept of breast-conserving surgery with an operation that he called a quadrantectomy. So if the cancer was in a particular quadrant of the breast, his aim surgically was to remove that entire quadrant, going all the way down to the central area at the nipple and then all the way out to the quadrant. He got wonderful results. The risk of recurrence in the breast was very low with this approach, but it still was a deforming operation and created cosmetic defects in the breasts after this was done. When we were doing mastectomies routinely for breast cancer, there were very few circumstances under which the surgery could not accomplish a very thorough and complete removal of the disease with normal tissue all around. But now, in the era of breast-conserving surgery, it's very clear that the meticulousness with which we approach the performance of a lumpectomy has a big impact on the outcomes for the patient later on. So it's clear today that getting a margin of normal tissue around the cancer as a routine part of the surgery leads to a reduction in the risk of recurrence of the disease within the breast for the patient's future. Now we know that lumpectomies are coupled with radiation therapy when patients have invasive disease, and we know that there's always a small chance of recurrence within the breast. But if we're able to achieve good lumpectomy margins, we can minimize the incidence of local recurrence within the breast for the patient's future.